Type 1 Diabetes by Teresa Fye. Are you constantly thirsty? Have you lost a lot of unexplained weight? Do you or a child you know urinate frequently? These are some of the symptoms of type 1 diabetes. So, are you or anyone you know diagnosed with type 1 diabetes? I do not have type 1 diabetes, but my cousin Haley does. She has been battling this disease for the past 9 years now. At a young age of 12, she was rushed to the hospital because she was always sleeping, had no energy, and displayed many of these symptoms. A few days later, she was diagnosed with type 1 diabetes diagnosis. Haley and her family had no idea what to expect her life to be like. According to the Juvenile Diabetes Research, about 3 million Americans have type 1 diabetes, and the amount of children under the age of 14 who will be diagnosed with type 1 diabetes expected to increase by 3% each year. Today we are going to look at what type 1 diabetes is, the role insulin and glucose play in the body, the symptoms, risk factors, possible causes, and treatments. This information will help you understand how type 1 diabetes works. What is type 1 diabetes? Type 1 diabetes is an autoimmune disease that causes the pancreas to stop producing insulin. First, it is important to understand autoimmune disease. Autoimmune is the failure of an organism to recognize their own parts, which then triggers the immune system to fight against its own tissues and cells. Second, it is important to understand how the pancreas works. Beta cells cover the pancreas and work to metabolize carbohydrates. Within the beta cells are islet cells and acinar cells. Islet cells are endocrine cells, which are inside the cell, and they produce and secrete hormones into the bloodstream. These hormones are known as insulin and glucagon, and they maintain levels of sugar located in the blood. Acinar cells are exocrine cells, which means outside the cell, and they produce enzymes to assist in the digestion of food. Now that you understand the function of pancreas cells, it's time to discuss the role insulin and glucose play. The pancreas releases insulin into the blood and allows sugar to enter the cells. This lowers the amount of sugar in the blood. Glucose is a sugar that comes from your liver or food, and it's the main source of energy for your body. Someone with type 1 diabetes has an immune response where it does not recognize the islet cells as their own, and then the body begins attacking these cells. Without these cells, the body is unable to metabolize any carbohydrates, and those regulate the amount of sugar in the blood. Therefore, this buildup of sugar in the bloodstream can cause a fatal condition called diabetic ketoacidosis. If your cells are starved for energy, then your body begins to break down fat within your body, puts an excess amount of sugar into the blood, and it releases a toxic acid called ketones, which are released into your bloodstream. Too many of these ketones put you into diabetic ketoacidosis. These symptoms result in symptoms such as nausea, vomiting, abdominal pain, a sweet, fruity smell on your breath, or weight loss. Now that you understand the role of insulin and glucose and how they affect a type 1 diabetic person, it is now time to discuss the symptoms, risk factors, treatments of type 1 diabetes. Some symptoms of diabetes are increased thirst and frequent urination, extreme hunger, weight loss, fatigue, blurred vision. You'll find the sugar in the urine, which would be a lot of the ketones, and then a fruity odor on your breath. Some risk factors that are contributed in type 1 diabetes is family history. So if you have a parent or a sibling that is diagnosed, then your chances of having type 1 diabetes is also increased. Genetics. It's found to be something, obviously, as genetics in the family history, but now they can do testing to determine whether your child could end up with type 1 diabetes. And an interesting fact from the Mayo Clinic is geography. They find that the farther away from the equator you are, then you are 2 or 3 times more likely to have diabetes. Some possible causes of diabetes, which these are all still being experimented, but they have found lots of studies that have found these to be true so far. Things such as viral exposures, many kids get shots. Epstein-Barr shot is one of them that can trigger it, and mumps so far is what they know of. What's interesting about this is a lot of these shots are when kids have to go get boosters to go into middle school or high school, and shortly after getting the shots is when people come up with diabetes. Having vitamin D too early in life, so starting milk earlier when you're a little kid, and a lot of times it's your diet as well. There are a few different types of treatments for type 1 diabetes. Most common is going to be insulin. You can either do a shot form or an insulin pump. For shots, you have rapid-acting insulin, long-lasting insulin. You have intermediate options. And then if you do an insulin pump, which is a little bit more severe cases, it's about the size of a cell phone that's worn on the outside of your body at all times and connected to you by a catheter. And it constantly measures your blood and puts the insulin into your body whenever you need it. Exercise and maintaining a healthy weight is one way that you have to treat it. And then monitoring blood sugar. And you want to make sure that you're keeping your blood sugar at a normal level. Oftentimes, it's required to monitor your blood levels at least 4 times a day. The blood levels change throughout the day because of the food you eat. Physical activity, medication, illness, alcohol, stress, hormone levels, pregnancy, and age can contribute to different times of the day and different times of your life where insulin is different. Type 1 diabetes is vastly growing each year. So if you or someone you know is battling with type 1 diabetes, I hope that now you understand what type 1 diabetes is, how insulin and glucose play a role in your body, the symptoms, risk factors, possible causes, and treatments, and a little glimpse of what they go through each day. Haley now spends her days eating healthy, getting exercise, maintaining a healthy weight, and monitoring her blood sugar for the rest of her life.